Hello, everyone. I'm Saleha, and this is Chai Chat and Community. October is Mental Health Awareness Month, and tonight we are talking about children and mental health with Dr. Raj Khillan. Did you know that about 1 in 7 children and adolescents aged between 4 and 17 have experienced a mental health condition in Australia? The most common disorders are ADHD, followed by anxiety, depression, and conduct disorder. But before we start and I start talking to Raj, I would like to acknowledge the traditional owners of the land on which we are meeting tonight, and I pay my respects to their elders, past, present, and emerging. Everyone at some times feels sad, angry, or upset, including children. But if a child feels like this most of the time, it's a sign that they need help. Dr. Raj Khillan has been a regular guest and a contributor to Chai Chat and Community, and I cannot thank him enough for all that he does for me. And he is going to talk to us everything related to children and mental health and what we as parents can do to help him. Thank you once again, Raj, for joining me. Thank you ever so much.
Thank you, Saleha. Thank you very much for having me.
Okay, first of all, simple language because most of us don't talk mental health, and especially that children can go through mental health. What exactly is mental health, and why is children's mental health important?
Yep, it's a very important question. There is a no exact definition of mental health because what mental health means to you may be different for me and may be different for people in the Western world here. And but in a broader term, what I see, it is a state of your mind, state of your brain, which helps you to learn what is present at this stage and how we make decision best for our today and for the future. That is the state of, you can say, well-being, a state of health. In in different culture, this may be different. Like, if we talk about, like, because as a pediatrician I practice, uh, and where we have uh, people coming from, children coming from all the multicultural community. So the mental health for children in the Western world is different. That is more in terms of the clinical perspective. So what is clinically you see, and so what we learn in our medical practice from the books, that is very much applicable for them, for the mental health. But when it comes to children from the South Asian community, children with Indian subcontinent, we talk about. Similarly, children from Aboriginal background. The mental health for them is very much connected with their cultural value, cultural experiences, family values, what we are learned in our family, sitting on a dining table, or over the generations, what we have learned from our parents, our uncle, aunties, our siblings, and how we practice that, how we practice in a day-to-day way. It also depends upon our spirituality, our religious belief. So mental health, for me, may be a big issues, but for someone it may be a black magic or bad omen, evil spirits. So that if we, the definition of mental health, the perception of mental health, the effect of mental health on that person, on that person's daily life or that child's daily life, it changes the family he's living with, the culture he's living with, the community he's living with. And that's where we need to understand, when I practice as a pediatrician and when I talk about the mental health, I change my strategies according to the cultural, family, community, religious, spiritual belief. Will my advice would be acceptable to this family because of this all underlying other factor? And if it is not, then my advice is not going to be they're not going to comply with my advice. It's going waste. So that's how the mental health I would like to define.
Thank you. We've already started getting questions. Uh, thank you, Chris. Thank you, Shreyoshi. Thank you, Kalyani. We will come to all your questions in a bit. But Shreyoshi has actually logged in from Delhi, and she says, um, the best time to understand, wish we had it then. Yes. Thank you for joining, Shreyoshi. Um, And Chris and Kalyani, we will come to your questions. I just want to go through a few quick questions that I had from some mothers, and I'll come to yours. So please don't go away. Stay with us. Raj is here. So, most importantly, how do you know children are going through mental health issues?
That's again, it's a, you know, children are very, very clever. Today morning, I put a post in Healthcare Awareness Society of Australia, the website which I run, and the Facebook page I run, and they give you clues for cry for help. It is us, it's up to us how we try to recognize that clues on our daily life. And a child who is been coming back from school, and then you ask, how was the day? And child say, good. One word answer. Horrible, good. That means it's giving you a clue that things are not going well. We need to dig into the story, what happened. But never asked direct question, because this is the way child is trying to hide the story and giving you the, sort of a signs underlying, ask me differently. What happens with your friends? So you need to ask the questions in a different way to read these clues and to go into the depth of the underlying story. If the child is who is spending more time in rooms alone, who has always been very bubbly, active, playing, that gives you signs there's something wrong. May not be always wrong, but you need to start looking into these signs and say, is there something wrong going on with my child? If the child who is losing interest in academic, losing interest in sports and activity, losing interest in activity which he was enjoying or she was enjoying earlier, and now showing lack of interest, then definitely there is something underlying. Child is showing signs of anxiety in terms of getting nervous, panic, anxious for certain unknown thing which was okay earlier, which he or she was tolerating very well, and going to public places were never an issue. Going to dark places were never an issue. Going to a concert or going to the crowded places was never an issue. But now the child is having some issues. Seeing a male figure and getting very upset and angry. Seeing a particular one person and child is getting very anxious or nervous or hiding behind you. So these are the clues giving you some signs there is something wrong. Child appetite is suddenly unexpectedly changed, either overeating, binge eating, or undereating. Not feeling hungry all the time, having feeling like throwing up, nauseous without any reason. Child who has not been sleeping well, being awake till very late in the night, in fact, till early morning, or at the other end, sleeping too much during daytime, feeling very tired and exhausted for a long time. So these are few signs and symptoms which I see, the very subtle sign which I think child give indication much before they coming to parents. They come to us for the help from a pediatrician, but we generally ignore these signs, or maybe not ignore consciously. We are not, as a parent or the caregiver, we are not tuned that well to pick up these signs that early. And that's what I would humbly request all the parents, to have a good connections with your children, have a friendly relationship with the children, have a good chat about the daily life, what's happening in the school, so they can open up if something going wrong in there, and they can open up early with you, and so that you can arrange help for them.
So what is early? What time? What age should parents start talking to their children, Raj?
Look, there is a no cut-off age. We need to talk to the child age appropriate at every age. You know,
From the time they're
when
two, when they
yes,
understand?
exactly. When the child goes to childcare in 2 years of age, and the
Yes.
toddler is having a tantrum over there, you do ask your childcare educator what happens. How was my child is doing? Is your child is playing with other children or sitting quiet in one corner? Is your child is eating there or not? So that would be, you will not ask more than that about the academic over here. You will ask about how the child is socializing with other children, how child is mingling and mixing with other children. Is the child is cooperative and playing with everything, or being very shy and sitting in a one corner? So every age group we need to learn to sort of work out the age appropriate questions or clues to read. And it become very tricky when it goes to the teenage. That's where the highest incidence of the mental health issue comes. And and of course girls are affected more than boys, and there is various reason the girls are less likely to be diagnosed early as compared to boys, because they know how to mask their signs and symptoms because of their better communication skills,
Okay.
better masking skills.
Chris, I'll ask all your questions. Let me just finish these and I will come to all of you. Um, I think you've kind of answered my other question, which was what factors affect a child's mental health and what are the signs you've just told me, and what can we do? Before I go to the questions, because I can see a lot of questions come in, I'll ask you one on COVID and then come back to the questions that I was sent. So, how has the pandemic affected mental health of children? For nearly one full year we were under lockdown, and children were in school one day, not in school one day, not being able to meet friends. I know a friend's son who is very, very sporty. He missed meeting a lot of his friends, and I know he was uncomfortable and unhappy.
Look, pandemic, in short, if I ask you, I will say it's another pandemic within the pandemic. So you can understand the meaning here that mental health, the COVID 19 pandemic has caused another pandemic of mental health issues. And the most commonly, subtly, severely affected population are the children, because of various reasons, because they were the most neglected subconsciously by us as a parent, by the community, because who bother about the children mental health?
Absolutely.
Okay, you haven't gone to school, it doesn't matter, because I was teaching you at home, but you are teaching only books. Who is teaching the social skill? Who is teaching the how to face the different stresses of life outside the house? How to learn the daily living skills? How to face the adverse circumstances? How to face is someone being rude to you? How to read the social cues of underlying hidden the messages what everybody want to give you. So we children, they miss everything. Children learn, they're so clever, they learn. Like we one way is communication skill, and one is a non-communication, non-verbal communication skill.
Non-verbal, yeah.
Verbal and non-verbal communication skill. The children learn a lot from non-verbal communication skill. Why you give any message by your body language, your hand gesture, your facial expression, your eyes, how frowning it is and how wide it is. They know it very well. So this is how they learn a lot about this thing. So they missed all the social cues reading skills during these 2 years. A 2-year-old child, you can understand, who is 2 or 2.5 year now, was born 2020 March, who is around 2.5 year. what do you can expect the social skill and that social skill will child will have, who has hardly gone out in Melbourne lockdown for 2 years time. So when he comes to my clinic, they scream like anything because they haven't gone out of their house. They haven't seen anybody except two parents in the house. So that extreme degree of social anxiety has affected this group of children. And when it comes to the other end, the teenage, that's another age where there's a lot of changes are happening in your body. Hormones are rushing up in your body, so you don't know what is right, what is wrong. You theoretically you say that yes, I am teenage, I've grown up, I can make decision myself, but the brain has not grown up that much, because the the brain growth, particularly when you talk about the social skill and mental skills, and that you learn from the daily experiences of life, good or bad. So that experience starts when you the first day you step out of your house. So this teenager was locked in the house for 2 years, and we were giving them electronics to get to pass their time. So now they're getting addicted to the electronics, and
Which
now
is
we
going
are
to be my
facing.
next question.
So,
Yes.
so we are facing another epidemic of children getting addicted, or what we call as a internet dependency syndrome.
Yes. So let me ask you the question that Chris sent immediately when we logged in. How does exposure to technology, phone, iPads, etc., affect a child's mental health?
Look, these all this screen time, all these gadgets are good as long as it is used within the expected hours of use, and what purpose we are using it. If generally what we say, there should be no electronic screen time in a child less than 2 years of age. Between 2 to 6 it should be 1 hour per day. 6 to plus it should be 2 hours that's a theoretical thing. But important thing is what material child is watching,
Yep.
what is getting addicted to here, and that is the most important thing which affect the child mental health get affected if they watch more violent type of video games. They play the video games which are very violent and killing of each other, the video games which are more sexualized from the teenage. It's going to affect their mental health indifferently. The shows where there's a drug addiction, alcohol is shown in teenage as a normal norm, so that's going to affect them. So their mental health is going to be affected. But yes, because nowadays the problem comes here when you say, oh, it means they should not have any screen at all. I won't say that it should not be in the present world. You need to be get connected with the world. You need to learn what's happening around you in your city, around in the world, what's new coming up. But as long as we are using it within the limits, 1 hour, 2 hour, for the entertainment point of view, I'm talking about. I don't count the educational aspect of screen time what we use. But the problem comes when you get use screen for 6 hours for educational activity, and then you use 6 hours for entertainment activity, and that's where the problem comes. I have seen children to that extent, those who are addicted to electronic, to that extent that whenever parents say to stop it, they go to two mode. One is absolute aggressive mode. So they get aggressive, they scream, they shout, they sort of extreme degree of defiance. Another mode, when you stop, they go to the panic stage, anxiety, they have shaking episodes happening, they can't live their life without electronic. So that's how the electronic use can cause a mental damage in daily life for the child. And that's where the parent role is important role comes. So make a rule in a very early stage. Don't let it go. Oh, don't worry. So that's where we start going to the slippery stage. All right, you can watch for this week for 6 hours because it's a school holiday. Next week, once the school holiday finish, we'll come back to 1 hour. No, it's not going to happen. It's not going to happen. Then you're going to struggle.
So keep a strict routine. If it's 1 hour,
Yes,
it's 1 hour.
absolutely.
through the school holidays and school days and weekends.
Absolutely.
Okay.
Absolutely.
Kalyani has a question, which is there a way that the children who may have symptoms of ASD may improve and not be diagnosed?
I didn't get the question.
Sorry, you want to see the question again? Yeah.
I didn't get the question very well. What does it mean? May have symptoms,
Do you
may
think, I think
improve
what
with
Kalyani
electronic
means,
means, use of electronics,
no, I think she means about depression and anxiety. That,
may have symptoms of ASD, may
yes.
improve and
So I'm
not be
guessing what
diagnosed.
Kalyani means is
Okay,
a child, an
I think
undiagnosed
I'll
child
try
with
to
ASD.
answer. And if she says that the question is different, please, Kalyani, just write back to me. Look, there are many symptoms. Okay, let's take it in this way. So the autism spectrum disorder is still a relatively, you can say, a new diagnosis for many people. Particularly if we talk about like Kalyani name, if I say that means she's in a from an Indian subcontinent or South Asian country. So for these country, autism is a just very new name. And I see in my clinic also that many parents they say, "Oh, we haven't heard this in my back in India. Is this problem only happened because my child was born here? Or should I take my child back to India?"
I think
So
it's
no,
kind of not believing that autism exists, and
exactly.
nobody wants to medicate their child at the first stage. It's
So
always it's first, no, my child hasn't got it. I know two people in my immediate family who are exactly that. No, my child hasn't got it, and love will cure all. Love
yep.
does not cure,
Exactly, you're right.
unfortunately.
So you then coming back to Kalyani's answer is that means there will be many children, those who have grown up to the adult stage now, back in South Asian country and even in Australia, I see 25% of the cases parents diagnose retrospectively once their child is getting diagnosed with ADHD or autism. And then because father say, "Oh, I got also the similar sign," or wife will say, "Husband has also had the same sign," or or maybe father will say, "Yo, no, my wife also had the similar signs." So maybe he got from there. So that means there is a possibility the children had the symptoms of ADHD. They improved up to some extent when they reach. If you don't do anything for autism, some symptom will improve, may not be 100%, but some symptoms may persist even in adult age. And that could be very much later on diagnosed as OCD symptomatology, like it's very finicky and very obsessed about cleaning hands, cleanliness in the house. He follows a very routine, like an army style. He doesn't like things to be kept haphazards here and there. And if the things are taken away from the way he's kept, he's going to be or she's going to be upset, angry, is going to be like the end of the world. Or he doesn't get the humor. He's so literal in his interpretation of the words. So these are the few, or maybe getting very impulsive, aggressive for small little things. You can't control your anger later on. Or he may be having absolutely super intelligent, like Einstein, on some of the things and lagging behind in other social skills. He hardly has any friend, doesn't like to meet anybody. He does to sit at home all the time. So these are the people, maybe some of them may have a missed autism diagnosis now. But again, say, so we start thinking about autism only when we have a package of the symptoms, not only the one symptoms. So when we have a combination of various symptoms together, then we start thinking about it may be autism. And it all depends upon how much awareness you have about the diagnosis. And some parents take it on board and they get the assessment, then proper assessment, and then they found out, yep, so it was my problem which has never been picked up.
I
Kalyani,
know people who've
am I right?
self-diagnosed later.
This is what you wanted to ask, Kalyani?
Um, I'm hoping Kalyani is still here and listening. In the meantime, because we've got so many, whoa, okay. Lots and lots of questions. So I will carry on. There is something from Kalyani. Okay. I'm going to show it on the screen, but she's explained. As in, he may show signs of ASD, but if he has improved, will he still be diagnosed for having ASD? As of now, my child is not diagnosed, but has a speech delay. Therefore, I'm wondering if there is a chance of improvement before being forever diagnosed. Hope it makes sense.
Kalyani, look, if your child has a speech delay, without going into much details, because there's a many other people have so many questions too.
Yep.
I think everybody should get the fair share. So, if your child has a speech delay, it makes sense to see a pediatrician and get the evaluation done, and leave with the expert hand to make decision. Is it worth going further for more comprehensive assessment? I'm not saying the first meeting will diagnose the things, everything, but at least it's going to open the door whether there is a need to go further or not.
Thank you. Chris wants to know. I'm going to show it on the screen because it's easy for you to read.
I
This
think,
is something that we talk about all the
yeah,
time.
Chris, this is a very, very, very intelligent question, I must say. And the intergenerational trauma, I think it's very important for people to understand what does it mean first.
I don't think people understand, Raj. That's the
Yeah,
thing.
okay. I'll give you a very simple way example. Intergenerational trauma. Uh, if you take, suppose for example, if I take on myself, my grandfather. Okay, my father did a wrong thing. My grandfather, what he used to do, what will say, जैसे हिंदी में आप बोलते हैं, अबे गधे हो तुम, तुम्हें कुछ नहीं आता, कितनी बार समझाऊंगा, तुम फिर वही गलती करते हो, चलो भाग जाए यहां से. ठीक है जी. नेक्स्ट जनरेशन में फादर ने मेरे को बोला, तुमसे कुछ नहीं हो सकता. ओके, मैं तुम्हें अब नहीं ठीक कर सकता, जाके अपनी मम्मी से बात करो, वो बता सकती है तुमको. ओके, मम्मी के पास गए, उन्होंने बोला कि बेटा मुझे भी नहीं आता. somehow I managed to do it. मैंने अपने बच्चों को बोला, तुम कर सकते हो, बुक से जाके पढ़ो. बच्चों ने अपने बच्चों को बोला नेक्स्ट जनरेशन में, बेटा इसको ऐसे करते हैं, लेट्स सिट इट टुगेदर, आई विल शो यू हाउ टू डू इट, यू कैन डू इट. This is how the transgenerational trauma
Yes.
happens. So, how you can change at this at the same example I gave you, how you can change this transgenerational trauma from trauma to achievement. So, पहली जनरेशन में जो ग्रैंडफादर से जो फादर में आया, so that transgenerational trauma reduced the degree of confidence in that generation that I can't do anything, I'm a useless person, ये मेरे बस की बात नहीं है. And this is what happened majority of the time in India. Because I have observed, sensed, seen around back in our days in India. This is what was exactly happened. So that reduces your degree of confidence, capability to do. You lose your own confidence. Say, no, मेरे बस का नहीं है, मैं नहीं कर सकता हूँ. And
And I
that is
think most of us have gone through that.
yes,
You know,
yeah,
I think as parents, we have changed. And I think our children, when they become parents, will change further. And hopefully, this will stop.
yeah. So that's where you can change the transgenerational trauma by being more positive. No, beta, tum kar sakte ho. I'll show you how to do it. If I don't know how to do it, I'll go and learn myself first and get back to you and I'll show you how to do it. You can do it. You have the all capability to do it. I'll find the resources for you how to learn it. and using the same message in a more positive and encouraging way. And I think, in nutshell, I mix the uh, whole thing together for a transgenerational trauma.
Thank you. Um, Suroshi has got a question. This is a good one.
Yeah, I think I will give Sarashi's question answer in the same. You mentioned one question that you are supposed to ask me, but I answered it that what are the risk factors? Something question.
Yes. So, what factors affects a children's mental health, and what are the signs?
Good. Yeah. So that's where we can talk more in detail. What are the factors which affect children mental health, or it triggers mental health? All right. So one of them is definitely parental relationship. How harmonious relationship they have together, or is it a fighting relationship all the time, screaming, arguments, or the physical violence is going on? That relation is definitely going to affect the child. Children, those who are witnessing parental fight, arguments, physical violence, 25% chances they are going to be not the victim, the perpetrator of physical violence later on. That's high incidence because they see, particularly male, being a dominant male and hitting your wife is a normal norm because this is what I witnessed my dad doing. So that's the one big thing which is going to happen. It can also, for girls, they are more likely to get victim of the domestic violence or physical violence later on because they believe that this was a normal norm because my mother suffered, she tolerated, and I have to tolerate in the same way because this is a normal norm in that society. It can cause extreme degree of anxiety, or the other way, it can cause to your gender identity disorder. And I've seen few girls, they witnessed the parental relationship issues to that extent that she doesn't want to be acknowledged as a girl. She believed her maternal grandmother, her mother suffered because of she's being woman girl. And I don't want to be girl because I don't want to suffer them same way. So that degree of protective phenomena happen in their life. So this is a sort of a protection. They made a sort of a shell, a wall around themselves. I don't want to be recognized as a woman now. So that is one how parental relationship is important. The children, those who are living in a very loving, caring family with this a good parental relationship, they definitely have a very healthy mental state, and they do well physically and mentally and academically at school much better. They are
Thank you.
sleeping better, they are eating better.
Related to this, I will ask another question. Um,
Yeah. Look, definitely, the first important thing what we need to do if you have a mental health issue, you need to understand that it does not make you incapable of looking after your children. You are still physically very healthy. Your executive functions are still working. You're making your decisions in daily life. People with depression, they keep working. They go to job. Many politicians, they work. Many doctors in depression, they are high achiever and performing everyday surgery. So it does not affect their physical capacity to work. As long as you acknowledge it that I have a mental health issues, And if I'm making some doubtful decision, some backup plan for someone to look after, suppose you have extreme anxiety and you have to pick up your child, for example, you have to pick up your child from school, and you have extreme anxiety of whenever traffic is slow, you fear that you may not be able to pick your child from school, and it's going to cause a lot of panic attack, and it can affect your driving skill. You may hit someone, you may have accidents over there. So that's where having in a backup plan, ringing your friend at that time and say, hey friend, look, I'm stuck over here, I may not be able to reach on time, can you please go and pick my child? Ring to the school teacher and say, look, I might be half an hour late or 1 hour. Please send you my child to the after school care, or be with my child till I come. Or
And
send to
schools do
the
it, especially primary schools do it because I've done it.
absolutely.
Yes.
Yeah. So what I mean to say, it does not make you incapable. The depression and anxiety can make you incapable in a very rare cases. People continue to perform daily life and still have anxiety and depression. Incapability come when you have been a very long standing anxiety and depression of very severe category, all happening together with multiple mental health issues, with a lack of support you have from family, extended family, society. You are keeping within you. You are not sharing your mental health issues with someone. You are not seeing a medical professional. You are not receiving any counseling, psychologist help, and you're not receiving any medical medications. That will make you incapable. So if you're having all that help around you, then you will continue to perform well. You can look after your kids well. And it is also always good if the child is in that age, discussing with the child about the issues is also important, and say, look, son or daughter, I have this problem. If any time I make a silly mistake, let me know. If our mummy is being silly, tell mummy, you've been silly. That gives you a thought process. All right, I'm making some mistake. I'm not making a right decision. Let me ask for help. So as long as we recognize the signs when to ask for help, it is safe to look after your children.
There are more questions, but I'll go to the ones that were sent to me before. So, anxiety disorder. How do we how do we deal with it, and what exactly is it? How, I mean,
Oh,
especially in a child, I know
yep,
what it is. I mean, you explained what it is in an adult. Driving the car, you may be late. You're anxious that you will not be able to uh, pick up your child on time. But in children, what
yep.
exactly is anxiety disorder, and how do
Let,
we
let
know?
me just put you in this way. I think in general public perception is anxiety means lot of worries, lot of nervousness. Okay, that is only one of the sign of anxiety. Lot of worries and nervousness. And when I ask many parents come in and I ask about, oh, we have anxiety in the family, but I don't think my child has anxiety because he's not worried about anything. That does not rule out you don't have anxiety. Anxiety in children may be various type. We talked about touch base before, social anxiety, like child being very shy, hiding behind parents, and when they see somebody new, somebody meeting first time, that's anxiety. Dropping the child to childcare and to the school, and it does not let you go. And literally, you need to really pull the child, or the teachers need to pull the child away from you. That's also separation anxiety, because child has been attached to you for so much that it doesn't feel comfortable and safe without you going to school. Little bit of that anxiety is okay, acceptable. Yeah, look, when you go to the prep first time, 2 3 months, everybody take a time to get used to. I was anxious when I came to 18 years ago to this country new. So it's something that is important. But when it start affecting your daily life, start affecting your functional capability, it start affecting your academic capability, it start affecting your thinking power, your day-to-day life, that means this anxiety now gone to the stage where there's a need of help. And when is that signs when it start affecting? You see in children, he is getting very upset and angry without any reasons. He's got a mood swings. He will be laughing right now, and after half an hour, he's been very, very upset, or she's been very upset and angry. Anxiety is more common in girls. Whenever there is a bad weather, I don't want to get out of the house because we are worried about thunderstorm, rain, hail, uh, dark. Child who been never been like having any bedwetting or urinary accidents during daytime, and now started having a urinary accidents after being fully toilet trained for years and years, now having a daytime accident on bedwetting. Maybe child is not waking up in the night because a bed has been changed to the place where he's scared of going to the toilet. That could be another signs of anxiety. Child is not going to school and doesn't want to go to school. Initially was very happy going to the school, and now feeling I don't want to go to school. I don't like school. But if you go to the depth of underlying things, majority of the time there is some anxiety happens, and which is being triggered by some factor there. Whether it is because of the bullying in school, somebody was bullying, whether they have a bad experience with the teacher, or whether they are having academically they are finding it everything is too hard and they're not able to understand. They're too difficult and they don't want to feel dumb in front of other children, other peers, because of the peer pressure, and the feeling anxious and nervous going to the school. So school refusal is another one. Separation from screen, which we already talked about, dependency, and then they become absolutely anxious, nervous, panic attack. That's anxiety. Child may be having feeling of sweatiness, or sometimes feeling pale, feeling chest pain, tummy pain, and pain here and there in different part of the body which does not fit into one system. Or sometimes I heard it. Oh, I had a chest pain. I have a tummy pain. Now let my legs hurt. I don't feel good. I feel like I have a lack of energy. I can't concentrate in the class when which I used to do initially. So something subtle anxiety can affect you in that way. So this comes in a form of a physical symptoms, what we call as somatic symptoms. And that is where you'd say child is otherwise not worried about, will not show, but it's a subtle signs which is showing. Many symptoms of asthma comes as a panic attack. So I've seen
Wow.
children being diagnosed as a asthma, poorly controlled asthma, referred to me as a asthma, but actually that was a panic attack. They had a severe anxiety with a panic attack where they were feeling difficult to breathe, breathlessness happening, chest pain, and getting addicted to pumps because they feel that okay, this is helping me. And when you go to the detailed story, I have to stop slowly all the medication, say this is what it is. It's anxiety, it's not asthma.
I have so many questions, but I'm going to ask you something. So, I write and I bring out the magazine for the College of Surgeons. So, we actually have written about well being and mental health because October is mental health. And one of the stories I've covered is from this really popular rugby player in New Zealand who's called Sir John Kirwan, who is popularly known as JK. He battled with depression and anxiety for years and years and years. And as a macho rugby player, you cannot talk about it. But
Yep.
he's talking about it and he's talking about it. Do we have such a role model in our society who makes mental health, I won't say normal, but acceptable? So that, parents, whether it is my age or young parents, they accept that, mental health is as important as physical health. And it is not just all about, I'm not feeling well today, but I'll be feeling well tomorrow, but actually go and get help and talk about it openly, because it's still not talked about openly.
Look, my simple comment, advice, recommendation, suggestion, whatever you can say, is we don't need to look for role models. For your child, parents are the best role model. Whatever way you present, they are our mirror image. So they don't need to look into the other role models. You model your child. You are the role model. So you, as a parent, need to say, look, I am not feeling sick. I'm not feeling well mentally.
Right.
I have an issue. Then the child will start accepting from a young age. Talking about mental health is not a taboo. It's not a stigma. I can talk about because my mom was talking about, my dad was talking about to me. The problem is, again, this is a transgenerational generation issues of hiding due to fear of victimization in the community, because of fear of stigma and taboos attached with. And particularly, it is worse with our South Asian community. It is worse. And if we are worried about, oh, if my child has been diagnosed with ADHD, autism, depression, anxiety, or any of these things, who is going to marry them? Society is not going to accept them. Or if I go to somebody's house, friend will say, oh, no, no, don't bring that child to our house. So my simple way by say, if they don't accept your child, you don't need to accept them as a friend. They're not friend. This is a bit of a out of the medical advice,
No, I know.
but but this is the way we need to role model for our children. We don't need to look for of course, when we have a person in society with a high profile rugby player, celebrity, Hollywood, Bollywood hero, when they talk about the mental health, we appreciate that, oh, he is doing or she is doing a great job, and people, because majority listen to that. But as a child, as a pediatrician, being dealing with the mental health of children, I don't think celebrity is needed for that. As a parent, you are the best celebrity, best role model for your child. So you need to change yourself for the sake of your child.
Um, Here's an interesting question from Chris. Does a child with an undetected mental health issues, I'm just going to show it on the screen, become a disturbed adult parent partner?
Yep, I think you already given the answer.
Yes.
In short, the answer is yes. There are many unrecognized mental health issues in children when they become adult. That means undiagnosed, that means untreated. And means untreated means it's going to affect the society some way, somehow. It's going to affect the community, it's going to affect the family some way, somehow.
And I'm going to combine this with another question that Chris asked is, do you think there's too much pressure on the children to become engineers, doctors, lawyers? All of us South Asian parents, we only want our children to be lawyers, or only want them to be doctors, or only want them to. I remember when my daughter finished year 12, and she was not interested in any of this. She wasn't interested in being a doctor, lawyer, or anything. She was just happy with whatever she was doing. And 15 years later, I think, she gets so many job offers, and she just got one last week, and she's doing so well. But I know some of, and we had, like you, moved 18 years ago, and people were like, what, is she not going to study medicine or law or this? And now that my younger daughter is a lawyer, it's the other way around. they're like, oh, you're the typical Indian parent because your daughter's a lawyer. So, do you think the pressure from parents or even the community, because our community is pretty full on, they have, they have a comment on everything that you do or how you should live your life. Do you think that plays a role?
Look, up to some extent, I believe, yes. I mean, when we were a child growing back in India, I'm talking about 30 years ago, yes, there was a lot of pressure. But I think overall things are changing and the pressure is less as compared to what it used to be many years ago. And they're like a doctors, engineers, a lawyer, or bureaucrat, IES. This was the only three, four top things in the community. And doctors probably you can say maybe more because of the society, financial, from society rank, position, respect, all the way point of view. But over the time, the concept has changed. Now, so many more job opportunity have come up because in our time there was a very few opportunities.
Yes.
Like electronics, IT job was there was nothing like IT at that time. So that has come up in last 20, 30 years. So definitely IT has changed the whole world in terms of job opportunity. And when the jobs are there and financial rewards are there, family are getting. So definitely it helps in changing their views too. But unfortunately, what I see here in in Australia, that pressure is more in South Asian family.
Oh, absolutely.
It is more than back in India now, to be honest. So, and that sometimes the pressure may not be conscious pressure, and it's more of as a subconscious pressure. All right. Like I give you my example. I mean, my own family. My daughter is she's a medical student in Uni Melbourne now, and we never told her that what you want. You need to be a doctor, and and but she wanted to be. She said, no, I want to be a doctor. And then I said, what? Tell me the one reason why do you want to be a doctor? And she said, Dad, since the time I grew up in last 18 years, I never seen anything else in this family, anything else talking about. Any everyday dining table, you are mommy, my wife is a gynecologist, so I'm a pediatrician. We sit together and almost all we talk about either something medical related, something patient related, something professional related. So I haven't grown up listening, watching something else. We got extended friends community. 90% of them are doctor. So what else do you expect for me to, interest get in? So what I mean to say, I'm talking about the subconscious level of pressure coming to them without we telling them that you need to be a doctor.
We have lots of questions, but we have very little time because I think anything over an hour, people will stop watching us. But I want to take one of Shreyoshi's question. We talked about physical violence, and she has something to ask about that, about children's mental health.
Yeah. It, if you remember, I talked about children are very clever. They read non-verbal way of communication, how your body speaks. So you don't necessarily need to have a physical violence all the time. You don't necessarily have to be loud screaming all the time. Children learn your body language. And that is good enough, whether it is a happy smile or whether it is a angry look or whether it is a disgusting look or whether it's a demeaning or belittling look you are giving to your child or giving to each other. So that body language, they read it and they try to mimic the same thing. So it affects them, definitely.
Body language. Um, I want to ask you one last question, um, which is, where can parents get help?
Look, there is a plenty of help available here, and that's where the importance comes about the knowledge of availability of mental health services, because particularly South Asian people, first thing we, if we have a poor acknowledgement of mental health, and then the lack of knowledge of health facilities is another important barrier to achieve, to get the help. So if I start with the mental health, like if we talk about perinatal mental health, like mental health during the pregnancy and delivery around, and then in the first 1 year, the mother mental health, how it affect the child growth, feeding, and development. So there we have a mother baby units. So where if mom is feeling too much anxious, nervous, depressed, or any other issues, or she is feeling incapable of looking after the little one because of her own mental health issues, there are mother baby unit on western side. Where Mercy Hospital has a attached mother baby unit. On north side, there is a mother baby unit in the private North Park Private Hospital. There is a Twiddle Sleeping Center, another one. On east side is a Queen Elizabeth Center. So there are multiple mother baby unit, and with the a new mother, four more mother baby unit are under construction, and I'm pretty sure would be ready. I think 2024, if I remember correctly. So that's about for mother and baby, where the admission is both for mother and baby together. So they are not separated.
Yes.
So sometimes
So,
mother get fear, oh, my baby will be taken away from me and I'll be in the hospital. No. So that's a combined unit.
okay.
Then
So the first port of call, Raj, should be the GP, and then they refer them to the pediatrician, or should the pediatrician be the first port of call?
depending upon what you look for. If you're looking for mother baby unit, then yes, it may be pediatrician, it may be GP, it may be your maternity child health nurse where you go. It can be visiting midwife, or even your obstetrician can also pick up the problems in during pregnancy or during labor, around labor time, and can make a referral.
Okay. I'll put the links.
Yeah.
I'll go to your website. I'll put the links and everything
Then,
else.
then later on
Government
in
website.
children, there are mental health issues in each community center. Like in a western side, there is a IPC care, and in Werribee, St. Albans, in Sunshine. So there are IPC center where there is a mental health services for young children. When it comes to the teenage, we have Headspace, we have Origin, and where the mental health services are available. Then we can talk online to various helplines are
Yep.
available, like a suicide helpline, like a
Kids
panda,
line. Yep.
like a PAND panda, perinatal anxiety and depression support group. There is a Beyond Blue will also provide. Even Origin can also give you online services. So there is a various online services which can be contacted for help, and which is all purely confidential. Teenager can contact them directly without parents' involvement, and it's absolutely confidential, and it won't be disclosed to anyone unless until the clinician feels that the safety is a concern, of the child safety is a concern, or can commit suicide for some reason, then definitely they need to reveal and involve parents, or other things will be open. Otherwise, it's all kept confidential.
Thank you so much. Thank you, Shreyashi, for watching, and she thanks you for this wonderful session. Thank you for watching all the way from Delhi. That is really good.
Thank you very much. Thank you, everyone.
Thank you, Raj. Happy Diwali, and I will see you next month.
Thank you very much. Good.
Okay, bye. Bye,
Bye.
everyone. Happy Diwali. Stay safe. Bye. Good night.